So I'm going to give us about 2 minutes to let everybody come in and start getting on, logging in. So if you're just now joining us, make sure you're getting comfortable, grab your coffee, grab your notepad, and we'll get started here shortly. I will say this, that if you have any tech support issues, issues with sound or connection or something of that nature, you can put all those tech support questions in the chat. And we've got the Dreamscape teams in the background that's going to be answering those and helping you with anything that we possibly can. So all the tech support questions go into chat. And if you have any questions for the presenters or for us as we're going through the panel today, you can put those in the question and answer section. So tech support questions go in chat. Questions for the presenters are going to go in the Q&A section. Also, something I really like to do, it's a lot of fun, is go ahead and put in the chat, put where you're watching from. I love to see like all the different cities and states that people are tuned in to watch these things. So go ahead and put that in there and feel free to chat with other viewers in there. It's a lot of fun. Look at that. I love it. Southborough, Philly, we've got Dallas represented, Seattle, Tucson. Come on. I mean, it really is it's a nationwide event. I love that. Good stuff. Columbia, Maryland. Let's go. Let's represent. Home of Dreamscape. Love that. Wonderful. Cool. Let's give just a few more seconds and we'll let everybody get comfortable and continue to log in here. Let's see, and then I'll go around and I'll do some introductions here shortly. Let's see. Good stuff. Minneapolis, Minnesota. Go. Baton Rouge, Louisiana. Come on. Welcome, Stephen. I'm right up the road from you. That. All right. Let's see. Guys, we'll go ahead and let's go ahead and get started. Once again, if you didn't hear me the first time, if you guys have any tech support issues, put that in the chat box, which should be down there at the bottom of the screen. And if you have any questions for the presenters, for us, you can put that in the Q&A box, and we'll be monitoring that as we go along throughout the session. So, all right, let's get started. So hello, everybody, and welcome to the 2022 Treatment Operations Overhaul, brought to you by the Institute for the Advancement of Behavioral Healthcare Leadership. I'm your host, Glenn Hadley, Senior Vice President of Strategy for Dreamscape Marketing and host of Perspective Matters, This Week in Behavioral Healthcare. Joining me today is an esteemed panel of experts in their own right, and they have each presented over the last year on trends we have come to realize here as we start Q2 of 2022. And we are excited to bring them all together onto one panel. So if you like what you hear today and you want to continue this conversation in person, please join us at any of the upcoming events. I know that most of us are going to be at NatCon, at the RX Summit, NATAP, West Coast Symposium, the Rocky Mountain Symposium, and East Coast up there at Cape Cod. And I definitely look for us there. We'd love to continue this conversation going forward, and we enjoy meeting everybody face to face. So look for us there at those events coming up soon. So let's introduce the panelists. So I'm going to start first with Ben Dittman. So Ben founded Avea Solutions, a revenue cycle management platform designed specifically for behavioral health centers. His passion is to help treatment centers understand and implement strategies to help them survive the upheaval going on throughout the industry. Ben is committed to fighting the addiction epidemic by helping treatment centers get paid fairly for the services that they are so desperately needing. Before founding Avea, Ben spent 15 plus years in banking, system design, and consulting. So welcome to the panel, Ben. Thanks for joining us today.
Thanks, Glenn. Appreciate it.
Cool. So next we have Brad Greenstein. Brad is a partner at Square Medical Group and principal at Recovery Associates, where he advises behavioral health providers on management, business development, and marketing strategy. Brad was also an early employee at Recovery Centers of America and brings a wealth of operations knowledge to the panel today. Brad, thanks for joining us. Appreciate you being on the show.
Thanks for having me, Glenn.
Right on. All right, next we have Dan Gemp. So Dan is the CEO of Dreamscape Marketing, a full-service marketing agency created in the addiction treatment ecosystem. With digital being the primary B2C channel in this space, he and the team helped more than 120 treatment organizations with 250 plus locations in 39 states successfully navigate 2020's pandemic related challenges, while also celebrating their 160,000th admission to treatment for people with the disease of addiction. Welcome to the show, Dan.
Great to be here, and I will do my best to connect marketing to what these guys all do instead of just talking about the internet like I usually do.
Right on. We look forward to that. Outstanding. All right, so our next panelist is Greg Keelan. Greg is the co-founder and CEO of Prosperity Health. He has 10 years of experience in finance, corporate strategy, and operations, working for the U.S. Treasury, General Motors, Chrysler, Laissez-Faire, Alita Care, and then founded Prosperity Health. At Prosperity, Greg leads the company's data and analytics efforts, as well as supporting clients in strategic decision-making and operational improvements. Greg, thanks for joining us today, man. Appreciate you being on the show.
Thanks, Glenn. Excited to be here.
Good stuff. All right, next we have Rick Del Giorno, founder and managing partner of the Raise Group. Rick brings over 35 years of experience in results-oriented alumni engagement to the panel today. Rick introduced the collegiate engagement model to the treatment industry. Working with over 200 volunteers, he successfully built a very active alumni association for a large national treatment company, creating 16 chapters and producing and executing over 350 events annually. This increased alumni referrals 689%. Millions of dollars worth a month in net revenue were gained while keeping costs under $100 per acquisition. Rick is also credited with creating tenets of practice for the industry, as well as metrics to measure successes and find blind spots. Rick, thanks for joining us today.
Pleasure to be here, Glenn. Thank you.
Right on. All right, and rounding out the panel today, we have a shareholder and vice chair of Polsinelli Law Group, Tani Weiner. Tani is a seasoned corporate lawyer with a special focus in behavioral health and specialty healthcare systems. He boasts an extensive track record of successfully completed healthcare M&A transactions, and regularly partners with equity sponsors and executive leadership in an outside general counsel role. Tani brings his 15 years of experience representing leading behavioral health providers to the discussion today. Thanks for being here, Tani. I appreciate it.
Thank you, Glenn, and all great to be here.
Right on. I just want to thank everybody for joining us today. We have a really good group here, and just excited to get started and to present this information. So I know that we're pressed for time here because we're going to try to cram all this information in here. So I just kind of wanted to get started and set the table. So I was thinking earlier, back in the fall of 2019, I asked Marvin Ventrell, the CEO of the National Association of Addiction Treatment Providers, otherwise known as NATAP, to present at Moments of Change down at the Breakers in Palm Beach. And I tell you, Marvin gave a really good talk outlining the explosion in the treatment marketplace and showed it seemed like thousands of new providers, mostly with the background in personal recovery themselves, they were entering the space. And we had, it was, this chart just showed explosive growth, but they were very siloed. And then he showed this kind of shift that took place 2016, 2017, 2018, towards more consolidation. And we're starting to see that, it's still being realized in the field today. So to kick this thing off, like, how has this landscape changed as it relates to this new operator in behavioral healthcare, and what are you guys seeing? And Dan, go ahead and kick us off in that. You've seen it from the marketing perspective, all these new operators coming in. What have you seen?
Yeah, it's been interesting to see some of the groups are coming in just looking to do lots and lots of acquisitions, right? Big private equity dollars, traditional mergers and acquisition work, large volumes and large dollars of transactions, right? But then we're seeing new models emerge, right? A lot of telehealth, a lot of MAT and outpatient models, just trying to keep up with the demand, right? We're still at a record level of demand, post-COVID, record level of overdoses. So like the market as a whole is growing, but the business models and the types of marketing we're being asked to do are expanding in pretty clever ways. I think that there is more innovation happening. and the marketing campaigns that we're running are for new and different models at a much higher frequency than we were seeing even a couple of years ago.
Right on. Is that what you guys are seeing? Like Greg, I mean, are you seeing that with more like just a changing type of operator?
Yeah, it's definitely interesting to sort of think about the last, I sort of tend to think about the industry in more or less 5-year chunks. And definitely there was a 5-year period sort of that ended right around the time of, sort of 2015, where, not to sort of be too crass about it, but this was a pretty easy business to be in. It was very early days in the addiction treatment and behavioral healthcare world. The insurance payers were still trying to figure out how this whole thing worked. The regulators were still trying to figure out how this whole thing worked. And it was relatively easy to enter the space and to be very successful without a lot of effort, without a lot of process and systems and expense around it. The more recent sort of 5 to 7 year period has, in my experience, has really seen that start to shift. And the business has gotten a lot harder to be successful in. And that's done a couple of things. The first thing that's done is it's really increased the need for professionalization and really sophisticated operations and analysis and thinking around all these different areas of the business. And the other thing is, to your point, it sort of changed the nature of the operators themselves to people who tend to be more focused on the business of behavioral health as opposed to the treatment side of things. And that's not to say that clinicians and sort of mission-oriented organizations can't be successful, but it definitely means that they need to start. They have needed increasingly over the last 5 to 7 years to really shift their mindset and incorporate the sort of business acumen into their operation in a lot more extensive ways.
Right on. Yeah, absolutely. And Brad, I want to throw this to you because you work with a lot of these organizations. Like, to Greg's point, like, is there still room for that kind of that grassroots startup, the mission-driven type operator to come in and grow from the ground up into a really viable business? Do you see? I mean, is there still room for that in the space?
Yeah, sure. Of course there is. And I certainly hope that there will be. I think what I saw was there was a influx of institutional investment dollars that came in and really pushed large national operators. What I've been seeing lately over the last year are smaller healthcare organizations, oftentimes assisted living, skilled nursing, coming in from an other side of the business. But what they're bringing with them is operational expertise around certain verticals like dietary services, environmental services, laundry, linen, housekeeping, these types of things that they've really perfected, nursing, and they're bringing it to the industry, but also bringing in the mission side of delivering healthcare services, not just looking at the income statement or balance sheet and wanting to make a decision whether or not they're entering into the space or not.
Right on. What, Rick, what have you seen out there, especially thinking from the alumni point of view, like, because there's no greater grassroots effort than from alumni, right? You're basically starting from people that have come through your facility there. Like, how have you seen that side of that end of it change over the last few years?
Yeah, so I've had the honor of working with many treatment centers and implementing what we do with regards to alumni. And it's funny, when I first started in this business, I worked primarily with perhaps somebody in marketing or someone in alumni relations, but more and more, I'm starting to work with more of the operations teams and the finance teams. And, they're looking at alumni as a revenue generating model, in addition to keeping, the work that we do and we help them with, keeping their alumni association meaningful, purposeful, and relevant. So it's been a remarkable shift in who I work with. And where I was in the beginning was just someone who visited and would work with their, as I mentioned earlier, alumni director, but now having a seat at the leadership table for, 4 to 6 months and really putting what we do on paper and do strategic plans and things like that. So honestly, the operator today takes it way more seriously than it did when we first started many years ago.
Yeah, right on. I appreciate that perspective and how refreshing it is that alumni is getting a seat at that table. Tani, I wanted to ask you with that shift and because I mean I remember like it was the Wild West there for a while and now it has become much more consolidated. What are you seeing on the M&A front with your clients as that kind of landscape has shifted with this new operating group?
Yeah, great question. We're seeing, a lot of activity across the board. I think it depends largely where you begin from. So to your question, there is room. The need for treatment is incredibly high socially. The reimbursement landscape and opportunity for innovation using things like digital telehealth to expand the reach of services is something that has accelerated dramatically with COVID. So I think there really is opportunity to get into the space. And if you're in that entrepreneurial mode, then with the right help, you can. And I would say that's a big caveat. And the folks here in the behavioral health Hollywood squares that we're on here, looking around the room, are the kind of experts who can bring the experience and well-roundedness to help people do that. And I think that's part of what we're trying to do, to make that perspective available to the mission-driven owner-operators. For me in my practice, we help groups like that launch and navigate the legal aspects of those. Obviously, that's not the only part to build a sustainable mission-driven business, but existing operators are looking to expand through de novos or acquisitions themselves of smaller providers. So if you're already in that and you're an owner operator and you came in here in the beginning of this most recent 5-year cycle, you probably have a business that's pretty desirable. Substance abuse treatment, some of the sectors you've listed, mental health is now extremely a high focus and big M&A hub that just came out of nowhere last year, it seems. Eating disorders perennially, hot, outpatient substance abuse. So there's a lot of those existing platforms who are doing that deal activity. And then at the sort of highest level, the institutional money that was referred to here, they're chasing deals. They're looking for platforms. They're buying platforms where they can. And once they've owned the platform, they're looking to grow the platform. So there's a high level of investment interest, transaction activity. It's exciting to be a part of for folks like those here who've been in it for a long time. And certainly for people who hear the call of the mission and want to help people get help. And I see a lot of really activity there. And a lot here we could talk about, but that's sort of my succinct run-on sentence there. So thank you.
Right on. And you bring up a really good point of, it wasn't that long ago where I would have to go explain a full continuum of care and the different levels of care that are encompassed in that continuum. And now, like, people that didn't actually go through it themselves are very familiar with the full continuum of care. And so it kind of it makes a nice segue into what, Ben, I want to ask you about here is, we have heard of this like full service continuum of care to of all of these different levels of care to wrap around a patient to kind of give them the best chance to enter long-term recovery. What is a full service or a full service operations continuum that of all these services that actually wraps around an operator to provide that care? What would that look like to have a full service operations continuum?
Yeah, so I mean, I really think that probably the themes there would be data, interoperability, and the use of experts. I think, like everybody said, the maturity in this industry has been just going through the roof. I mean, you've got PE companies that are coming in and they have a whole separate need for data. People that are selling need to produce more data. We're on the brink of getting into discussions around value-based reimbursement, which requires data. But then that all goes back to, how is this impacting somebody pre-admission? So from a marketing standpoint, what's the data? Who can market? How are you marketing? I mean, I'll sit down with Dan and it would take me a year to learn, what they're doing on the marketing side. What he regurgitates to me in about an hour. It's
You learned it all in an hour.
No, but having those experts, that specialty, then you get into the admission side. So we're seeing the technology around really understanding that whole patient up front. So verification of benefits, what the family's like, how do we want to transition them at different levels of care. Interoperability is huge. So how does your marketing system work with your CRM? How does that then translate into the treatment side of things? Then you've got what's going on the treatment side. Everybody is looking for more data. It's business intelligence, and it's connecting what's happening pre-admission through post-discharge. How do we integrate with wearable devices, for instance? How do you have single sign-on so you're not logging into 15 different technologies? How are we aggregating that data at once? Then you have post-discharge, the alumni side. There's not only how are you working with those patients, but what's the technology and how do you hand off and enroll people in that technology? Digital prescriptions for therapeutic device, applications are coming out. So I think with all of these, even in the treatment side, policies and procedures, Brad's there to say, this is what we can do operationally and efficiently. Post-treatment, you've got the billing side. There's so many changes going on in billing. If you're doing billing in-house, you should have a phone a friend, and you should periodically be doing audits on that. And then, on the legal side, you wouldn't go into a transaction without experience. And so, whether it's the M&A or when it comes to appeals and fighting the insurance companies, it's the data, and it's having the right experts in your back pocket.
Absolutely. It's a pretty broad picture. I run across operators in the space that get into it, and they figure that out along the way. Each step they come across a new, oh, I need that. Oh, we got to go do that. And realistically, there are so many services that can wrap around the operator while they wrap around the patient to create this smooth transfer of information all the way down through the continuum. On the operation side, Brad, this is a really pretty picture that we can kind of paint of having all of these support services from, marketing, talking to the CRM, to the EMR, to the billing, to the alumni professionals, and then to the human resources that are supporting. Does that exist out there right now? Are you seeing that at some of the facilities you're working with? Are they employing all of these things, and are they working together?
Yeah, I think the answer is sometimes yes, sometimes no. There are definitely operators out there that have become sophisticated, or even, I would say, started in a sophisticated manner and have created systems that talk to each other and that produce data that's useful and valuable. And then there's others that are really just trying to understand how to operate on a very basic level, how to care for patients at that most basic level. And the other pieces they're just not there yet. And that's okay too. We can work with clients just like that and help them get there. I think with respect to the continuum of care, one thing that I've been seeing is that a lot of larger operators, and even smaller ones too, are starting to understand that mental health needs to be added to a substance use disorder continuum of care. If you really want to treat patients coming in with co-occurring disorders, which many have, adding these mental health services becomes critical. And the advantage of having a broad continuum of care is that you could place the patient in the right level of care for them. Sometimes that's a high level of care, sometimes it's a low level of care. But, Ben was talking about value-based contracting, and while that's still primarily in the Medicaid public payer world, that movement is about finding the right level of care and, not having people use inpatient psych hospitals as de facto housing or inpatient detox as de facto housing. So I think the operators of the future understand all of that. They're bringing mental health into SUD. They're bringing data into all of this, and they're coming up with, I think, it's inspiring to me, coming up with great solutions for complex problems.
Right on. What would you guys, and I want to open this up to the group, what would you say are some of the barriers to this that you've experienced? And if you can share how those were overcome, that's great. But like, what are some of the, I do want to start with Greg. Greg, what do you think are some of the barriers to this, to putting these systems in place and having them talk in across the continuum?
Well, I think one of the things that's been challenging is, frankly, just it requires a certain level of knowledge and experience and skill across all of these various different areas that is just not easy to come by, and certainly not easy for one person or even a small, founding team or executive team to possess all in one little group. The example that I always use, I've participated in different ways in a lot of M&A in my career. And some of it I've been privileged to work with Tani and his firm on. And one of the things that I really love about the lawyers that I've worked with has been their ability not just to understand the legal issues, but also to understand the business issues that are at stake. So they're understanding the negotiation from my perspective, as well as from the perspective of making sure the contract says the right thing, making sure we're in compliance with the law, all of that type of stuff. And so the issue, that same type of issue arises when I'm working with Dan and his team, for example, when the billing and the marketing folks are trying to communicate and share data and sort of create business insights that are going to lead to action and improvement in the organization, it's really important that I know at least a little bit about what Dan does, and that Dan understands at least a little bit about what we do. And there are enough of these different little specialized areas that it's really hard to have that sort of those competencies and those cross section of competencies in a small, executive team. And so that's one of the things that I think is, at least in my experience, has been a barrier that I've seen in people who've been trying to implement this type of stuff. They just need to learn enough about all of these different areas, which is a really difficult thing to do other than by experiencing them directly over time.
Right on. And it kind of fits in. There was a question in there in the chat that someone was asking about actually defining this full continuum. And so who'd like to take a crack at just briefly defining a continuum of care, and then also like how we're positioning this continuum of operations to go around that? Who wants to do that one?
I think we should use my universal translator, Brad, for that.
I'm happy to try to define the continuum of care. And I think the easiest way for me to answer that is to use ASAM. And the American Society of Addiction Medicine starts the highest level. They start with is level 4.0, which is hospital-based detoxification. After that, it's 3.7, which is the residential detox that most of us are accustomed to. After that, 3.5, which is inpatient treatment, the typical step down from 3.7. There's 3.3 and 3.1, which are not commonly used levels of care, and mostly because they're not reimbursed by commercial insurance payers, or at least normally not reimbursed by commercial insurance payers. In Massachusetts, and I think it's worth mentioning, Medicaid pays for 3.1, which is a really fascinating level of care. It's residential recovery services. And one of the ones that they cover that we provide out there is co-occurring enhanced recovery residential services, which is a 90-day to 180-day program. It's based out of a residential non-institutional setting. There's clinical, there's psychiatry, there's case management, there's 24-hour staffing, but it's not at that institutional level. And because of that, the costs are low enough to allow for a 90 to 180-day stay, which for some people is exactly what they need, and for some people not what they need. And that's really where the ASAM comes from. After the level 3s, which are residential, you go into level 2. 2.5 is partial hospitalization. 2.1 is intensive outpatient. Then you're into level 1, which is general, individual, and group counseling. and the not very often talked about 0.5, which is early intervention. But I would actually say in an exhaustive mental health and SUD continuum of care, that one actually becomes pretty important, because that's where you can prevent a lot of escalation into higher levels of care, where you catch people early into episodes that would cause further complications or further acuity. So I know that sounds like a lot. You add telehealth to that, add peer support recovery services to that, and you have and more. I'm sure people are thinking about other ones that I haven't mentioned, but generally speaking, using ASAM and looking at some of the wraparound social determinants of health services like transportation assistance, educational assistance, housing assistance. That's what a full continuum looks like.
What the marketing guy heard was you sell some kind of medical detox and stabilization and quickly move on to a therapeutic alliance, which, based on utilization and need, can take a short or a long period of time. That was an awesome answer, Brad. I hope everyone was listening.
And speaking of that, I do want to say that with all those different levels of care, all of the services that we're all here talking about today need to exist at every level of care. And one of the challenges that I ran into in prior iterations was whenever a patient would transition from one level of care to the next, even within the same company, the support services and around it did not communicate, and oftentimes the treatment episode almost needed to be restarted from scratch at each one. And so my friend Dave likes to talk about this idea that these different systems are like a series of lakes that aren't connected, and a stagnant body of water like that just eventually dries up and turns to dirt. So like, how do we keep these systems from being siloed and stagnant and communicate? How should they integrate with one another? And Dan, I'm going to ask you about that one.
Sure. Great. I like the analogy. I got a really good visual on that, right? A whole bunch of puddles drying up next to each other, but none are touching. So Brad referenced earlier the operators of the future, right? And we're all looking ahead what's going to happen next, right? In each of our roles as service providers in this space, we have to innovate to stay relevant, right? And so we're looking further ahead. And what I'm seeing is data. Any organization in this space that's going to succeed for the long term used to be an advocacy organization, right? Fight the stigma. Let's help each other get well. It was a social cause. And so everybody would say things like, I've got a guy for that. You need a website? I got a guy for that. And it was a person, right? And what I hear now over and over and over again is, I've got a system for that, or check out our CRM, or check out, we're doing our billing in-house, check out the dashboard. Let's get a third-party audit in here. Let's get the M&A guys to review it to see what our market value is. Like, it's a much more complex board level conversation. So what I'm seeing, I guess, on the marketing side, the requests we're getting about 10 times more often than we were 5 years ago is, can you integrate all of the marketing data, my cost per call, cost per qualified inquiry, and cost per actual paid admission? Can you get all of that integrated with my dashboard, right? My business intelligence system. And then we start talking to EMR experts and saying like, hey, we got all these great, highly qualified admissions for this client, but what's the AMA rate? How many of these people are actually completing the recommended course of treatment and getting paid, right? And then on the marketing side, it's an exchange of data with billing, right? Who are your best payers and who are your most consistent on-time payers? And did you realize that if you share that billing data back with your marketing team, that you can actually target that best fit patient, not just by financial qualifiers, right? If you're getting paid more and more of the time, it actually means you've refined your clinical approach to a best fit patient type, right? And then as you go through this continuum, right, we're just sharing data along the way, integrating with CRMs and call tracking on the front end, integrating with EMRs and billing as patients go through the process. On the back end, it actually turns into a network. And we're seeing clients that are generating 20, 25% of their admissions from alumni, but it's been systemized, or it's not just the heartfelt, advocacy of an alumni. It's readmissions based on medical need and trust, right? Like any good medical system. And then it's actually building a community where maybe on the front end, there's a certain marketing cost to acquire that patient. But later, now that they're, in your community of alumni, there is a $0 cost for them to come back, and it brings down your average marketing. So like all of these pieces are now interconnected, where an alumni referral, friends and family of a successful alumni, are bringing down your marketing costs, and your value per patient is being brought up by sharing your billing data with a web geek, right? And so that's what I've been seeing the most, right? How do you connect the lakes? You integrate all of your tools and systems. And if you're doing these things in-house, that's fine. Validate them with some third party's data, because your in-house person for billing, for evaluations, for any of this, they don't have all of the open market data that everybody on the screen right now has. We're all leveraging that. We're leveraging other clients' data, other partners' data for planning and success. So that's what I'm seeing.
And I'll make a quick comment around data. So there's a term data lake, and a data lake is an isolated aggregate of data that's unstructured, not ready to be used. And what you want to do is you want to take a data lake and turn it into a data warehouse. And that data warehouse then becomes snapshots in a usable format that can feed business intelligence tools, analytics, integrate with other platforms from an interoperability standpoint. But yeah, I think that as an industry across the board, there's a maturity in data, and we're having to put huge investments in technology to bring hierarchy into that data, think how it's going to connect through that full continuum, and how are we going to, and I think one of the key things that Brad was talking is that transition of care. That's huge. And how do we take all these disparate data tools and applications and meet the patients where they need to be met without it being complex for, your clinicians to have to log into 4 different systems, your patients having to remember 3 different passwords. So I think that everybody should be looking at a data plan and really kind of thinking about what are they planning on doing over the next couple of years, and operationalizing that data. And then, like you said, Dan, really validating it. And then where we need to get as an industry is benchmarking. We need to be able to look at each other and see where we're benchmarking from an internal treatment side, an outcome side, marketing side, and then working together as a group to aggregate this data so that we put the power differential back in our hands, and we can sit down with the payers with data and accurate data and fight for fair reimbursement.
The word you used, sorry, Glenn.
No, go ahead, Greg.
I was going to say the word you used a minute ago, Ben, that I really liked was operationalize the data. And I think that's, I want to just pick up on that for 10 seconds and just emphasize how important it is. The data in and of itself is fantastic, and it's a necessary first step. But the really important thing is to have an ability to take that data, learn a lesson from it, and change your behavior as an organization in some way based on that lesson that you learn. And that's really the thing that, is in a way the hardest, step to get over, because that requires a level of insight and a level of, sort of strategic thinking. And again, sort of to my recurring theme here, I guess, is sort of cross-disciplinary. You need to have folks in your organization or advisors around you who are able to take that data and really do something with it that's going to change the results for the organization.
Yeah, and what I think is so interesting about what we're doing, I have the opportunity to work in some other verticals and some other areas that closely mirror behavioral healthcare. But whenever I talk to them about their current, at least their marketing efforts, and I start asking them if they can tie the direct ROI to their marketing efforts, a lot of times they can't, and they're still looking at impressions and click-through rates and older standards of measurement rather than a real return on investment. And whenever I talk to them about it, they say, "You mean you can actually tie the result to the marketing effort?" And I'm like, absolutely, because in this space, we've been doing that for a long period of time. we're judged on that. And so I start, the move that we're seeing with, like Ben, what you guys just did, where y'all actually merged two of the service providers together to hit the medical record side and also the billing side. That it's really cutting edge, and we have the ability to do that in this space. Some of the stuff we're doing here will be realized later on down the road in other verticals, but we're really on the tip of the spear, so to say, here in behavioral healthcare. So Tani, I want to ask you, with all of these services and the kind of the cutting edge coordination that we're doing here, are you seeing that on the valuation side, where companies that have all of these around it, are they being looked at differently than ones that are, say, maybe in the emerging phase of this?
Absolutely. That's a great question. And I think it's critical. Buyers are looking for quality programs. They define quality based on, obviously, EBITDA is a commonly used rule of thumb, but as they get into due diligence, they want to know, is it sustainable? Is it real? So they're going to have folks like Greg do quality of earnings and see if the data that you're internally reporting matches what you're asking for. And that's the first thing that'll happen in any sale due diligence process, external benchmarking of what you internally think you're doing, especially smaller operations. And there's a lot of them in behavioral health. They don't necessarily have audited financial statements or other things that sophisticated buyers are going to want to tick off in their diligence list. So that's an important one. Reimbursement's probably the next one. Are you in network? Are you out of network? If you're in network, what are your rates? What's your relationship like with your payer? I remember sort of, years ago when I was in-house at CRC, everybody wanted to bust out of their in-network contracts because out-of-network was the rage, and it has now come full circle, and everybody's dying to get to an in-network payer agreement because out-of-network may have been a good sugar high for a period of time, but the downside is the payers caught up and kneecapped in so many different ways, but also particularly coming back for recoupments and audits through their special investigations units. And so buyers are going to want to know after they test the EBITDA whether it's, even if it measures out and pencils out, are they going to be able to achieve it in the future? Because is your reimbursement stream, is your revenue cycle healthy? Is it sustainable? Do you have things that you're relying on, for example, labs or black hat or gray hat marketing things that might be legally questionable that are going to run you into a buzzsaw later? There's been a lot of evolution through that area that Dan can talk about in terms of how to make it ethical, credible, sustainable, best practice stuff, and not just rely on, well, hey, it's industry standard. We still hear clients say, or sellers, if we're on the buy side, that things are industry standard. And I don't know that really, washes in the real world. The world has been changing. I'm sure, Brad and some of his experience can talk about the importance of picking making sure you are licensed for the right thing and you have the right credentials. That's essential also. If you've got that stuff, great. If you don't, the buyers are going to see it in diligence, and you're going to have a real discussion about, is your zoning right? Are you within the state license standards? There's a lot more that's been happening here. The business was simpler a while ago, and with the opportunity has come the oversight and the regulation. I could obviously go on. There's things here operationally in terms of the numbers and the data that Ben's talking about that I don't see as directly, except to say that a quality program will have authentic, good outcomes. And if the data is bad in that area, if you have had incidents, if you've had lawsuits, if you've had losses, whether it's on patient care issues or whether it's on, in your employment side of the house, there's a lot of seats around the table that good behavioral health providers rely on. And there's a lot of them here, with us here, and a lot of Glenn, you and team who've, been here can, help people along. I think you had said it earlier, and it rings true to me, Glenn. A lot of providers we work with who are entrepreneurial, who've built something, it's like they will learn as they go. And we will usually find them when they're getting ready to sell their business and they've never been through a sale process before. And it's like, well, now what do we do? And we totally get it, but that's exactly it in the sale process. And I think the investment that you can make to get these pillars right will get you a better valuation and a smoother process with fewer surprises as you proceed to, hopefully successful realization.
Right on. Thank you for that. I appreciate it. And I know that we're getting short on time, and you know, Rick, I haven't forgotten about you. So although I will say this, that alumni engagement often it is forgotten in treatment center operations, and it's almost an afterthought. I've done a number of education panels on really how alumni is not just the lowest cost per acquisition for a facility, but it's also definitely a pool for new staff and people that are tied to your community. So like, just tell me, how do you tie in the operations or tie in alumni to this operations continuum before we wrap up today?
Yeah, sure. Thank you. You're right. Alumni engagement or alumni family and friend engagement has always been an afterthought, and it's okay. It makes sense if these great panelists talk about the beginning, and then when care is over, what happens next. But the thing I'm finding is more and more CEOs and operations people are calling to say, hey, Rick, we need your help in setting up a system. I think that was mentioned earlier, not just doing a few picnics here and a few barbecues there, but a system, because a really good, true alumni engagement program is going to provide meaningful, purposeful, and relevant engagement from the moment the person steps on campus. And they're going to engage those individuals from the first welcome. Alumni are now being used to help with AMA blocks. We have a SAMS program, a Site Alumni Mentor program that we institute. We have alumni that we use when people leave. It's a regional alumni mentor program. So alumni are not necessarily sponsors, but they're mentors and getting people into the continuum of care. What's also been fascinating, we're finding, is when people get involved in an alumni association or alumni program of some sort, a lot of organizations out there don't have it, period. So if Glenn, you and I are in recovery and we're in XYZ town, hey, what are you doing tonight, Rick? I'm going to go bowling, or I'm going to go to a meeting, or I'm going to a career services center session with my alumni association. Gee, I don't have that. So there's a thing in this world called the drone effect. What's going to happen is, as you get involved and engaged, you're going to refer people. Folks that are families or loved ones that are engaged in alumni association activities are going to refer from, because there's not just welcome to treatment, thank you for your 30 days, have a good day. That continuum of care continues. The care switches to engagement because we're not licensed therapists, but that continuum of care. And it really, what I think Brad and others would say is, it says we care. So people want to be a part of something that's big. And yes, they do get alumni that come back and work. They do get alumni that go on and create businesses around recovery, help each other, career services, et cetera, et cetera. But it's now and becoming more and more a part of that continuum of care. Brad and I had the honor of working with some very similar organizations, and we were very successful. From the moment, quite frankly, we got people involved. How about, Brad, when people were interested in coming to a facility, and we were able to engage alumni in that recruitment process. So yes, it is good to have them have a continuum like that where people want to come back to the facility. Recidivism rate does drop significantly when you do keep people engaged beyond treatment and not just send them on their merry way. But also it gets them involved and builds life skills and such like that. It's now become, for marketing purposes, as Dan would tell you, it's now become a benefit, because let's face it, at the end of the day, people are saying, I'll be happy to come to a treatment center, but what's in it for me? And so now we can answer that question. We just don't say, thanks for your money, have a great day. So that's what we're finding. That's why we've been busy, and that's what we're continuing to do. Make it a system, a part of the overall operation, not just barbecues and volleyball.
Right on. And speaking of the system, like the whole purpose of this and what we're talking about today is this idea of really surrounding each patient in a system to where we can keep track of and support this patient on their journey, all the way from the very first click on the internet, all the way through the continuum and out, and then hopefully into a life of service that revolves back to the beginning again. So with that picture being painted of all of these wraparound services and and really talking about a full service operations continuum. How do we bring this to bear? Like, how do we start? And this is for anyone. I want us to jump in. Like, how do we really implement this full service operations continuum? How do we start?
Well, one thing I want to add, Glenn, is when you talk about alumni, the thing that I think a lot of people will talk about leadership. I know Brad's been in very high leadership positions, Dan's in marketing. One of the things that's great about alumni and alumni association, the engagement and families, is the fact that it's great focus groups, great feedback. We can have an idea of how we want to market something, or leadership wants to go in a direction. We can go to the alumni association or alumni council and say, hey, we're thinking about this. What do you think? How does that resonate with the people you hang out with? So I thought didn't directly answer your question, but I think it's important that, even though we are doing these fun things at the end, it serves such a purpose for the operators and what it is they wish to plan and they wish to grow. Would you agree with that, Brad?
Yeah, absolutely. And, I would add, if people are looking for kind of a way to dip their foot into the data lake, the analogy we've been using, my suggestion would be, most likely, if not assuredly, your state requires you to collect certain data. The Joint Commission and CARF require you to collect certain data. Don't just do the bare minimum, right? Like, actually collect it for the purpose of using it to improve your program. The Joint Commission requires validated outcome measurement tools to be used. Don't just meet that minimum standard by saying we throw our patients a survey every 30 days and we don't really look at the information per se, because when it does come down to, I want to be a network, or when it does come down to, I want to be involved with value-based contracting, that's the data that they're looking for. And when it's time to approach a payer and say, I want to work with you, they don't want to talk about rates first. They don't even want to talk about rates second or third. They want to talk about, the quality of your program, how you measure that quality, the clinical and medical services that you provide. So the best way for me to get started is take what you should be doing anyway, and likely are doing, but really start operationalizing it, to use that word that
the word of the day.
The word of the day. And I think everyone on this panel can provide concrete ideas of what that looks like in their own separate, specialty. But, I think any of us would be glad to help if someone's wondering what that is.
I'll just add on. I mean, I think you have to be realistic around a plan, and start now and start incrementally. Bring the right people in, lay out priorities. It's going to take a while to get everything linking together, understand what you have validated. But if you don't start that process now, scrambling at the end is only going to cause a bunch of headaches. And then bringing in people who have done this before. They don't need to do all the work, but from a guidance standpoint, it really makes a huge difference.
Yeah, I was just, sorry, Glenn. I was just going to, sort of add on to your last comment there, Ben, that, I think that for me, what I've been thinking about the last couple of minutes is push people outside of their lane. Don't let people stay in their comfort zone, whether it's inside your organization or, service providers or advisors that you're working with. If you're talking to Dan, ask him about billing. If you're talking to, Ben, ask him about the alumni. This is the way to get people thinking across these lines and start to, bring those lakes together into a river, or whatever the opposite of what did you say, Ben? A data warehouse. Convert the lake to a warehouse, which is kind of an odd analogy in my mind. But anyway, I think that's, push people out of their lanes. Don't let people sort of stay in their comfort zone. I think that's something that, to your point, Ben, that you said a second ago, it's a small thing. You can start it right now. It may not bear fruit in the next 20 minutes, but over time, if you get people thinking about things that are outside of their immediate scope of activity, it's gonna compound over the long term.
And often it's thinking with the end in mind. So what do you want the results to look like? And then back into the data that you need to get those results. And again, don't just think about, think across the entire continuum. So how do you pull that marketing in all the way to outcomes, to, you know, alumni engagement? You should be able to follow that continuum of care, and have basically business BI dashboards with key performance indicators for each level.
A quick thought that several of us have referenced. So we all, most of the folks on your screen right now, think in these 5-year increments, both for business cycles and life cycles of an industry, right? That's how long it takes to evolve. You should have a 5-year plan for your business. I assure you that we all do. And you're at different stages. You might have a small psych practice. You might have a brand new outpatient center that Brad just helped you get licensed. And you might have a giant multi-location residential program. That's okay. If you can identify where you are in that 5-year plan, it will let you know, hey, am I just beginning using Google to generate inquiries, or am I at this advanced third-party billing audit, advanced EMR to billing software integrations, and plugging in my call tracking metrics with all of my automated programmatic display advertising, right? You need to know on that spectrum, like how sophisticated do you need to get? Are you in the beginning stage of baby steps, or the later stage planning for an exit where you might want to ramp up your marketing, but the optics need to be consistent because even your M&A attorney knows how to evaluate marketing these days, right? Especially your M&A attorney. So keep that in mind, that if you can identify like, hey, here's my 5-year plan and here's where I fall, you know, kind of compared to the rest of the industry as a benchmark, that will help you to establish, you know, what efforts you should be making now versus down the road.
Yep. And I look back at even the last, like 5 years ago, the industry has shown us that we're moving in this direction, because realistically 5 years ago, there were so many operators out there that were only operating in one part of the continuum and were referring around the different parts of the continuum. And now we are just not seeing that. That is actually not the norm anymore. We're seeing many different levels of the continuum being represented under one umbrella, which makes it even more important for all of these services to communicate with one another. And just like it's been shared, I think by every panelist today, is that it absolutely makes business sense. It definitely affects the bottom line in a positive way if we're leveraging our data. But realistically, at the end of the day, it is about patient care. And if we can communicate amongst one another all the way through the continuum, it just provides better care for the patient. Really does. So guys, we have just a couple of minutes left. I do want to answer these 2 questions that have been posted here. And this is kind of a quick one. Are there any other others you'd recommend besides using ASAM to determine level of care? And that's, I know ASAM is pretty much the standard, but are there any other resources you guys would use?
For me personally, no. The standard universal language tends to be ASAM, and the insurance payers work off of that. So I think don't be like Massachusetts, which has unique names for all these levels of care, like ATS equal detox and CSS equal residential. Speak a universal language that everyone understands.
Right on. Thank you for that, Brad. I appreciate that. And last question
I'll say,
here.
sorry, I think ASAM, just what it has going for it, in addition to what Brad said, it just seems to be getting imposed. For one thing, California has recently adopted statewide that they want licensed providers in the state to abide them. It's a relatively recent move. We've seen payers, Optum, for example, insist that substance use treatment providers align their care to ASAM criteria. Why did Optum decide this? Probably for their own reasons to try and not pay claims, but they picked it. And so it does have currency going for it. And not to say it's the only one, but I think a big overarching thing here that we've touched on is it depends, like, where do you want to be and what are you going to? And that you got to work backwards from there. So your 5-year plan should be informing where you're going. Not everybody needs to go to the same place, and there might be better ones for one particular place. Or it depends kind of where you're starting and where you want to end up. And I think there's an ASAM in terms of what Brad shared, and maybe others, but certainly from the legal perspective too, it does seem to be the direction things are going for most.
Right on. Thank you guys for that. And we are running out of time. So Tanya, I know you had asked about is the group prepared for a harm reduction model as it relates to marketing and billing? Just say yes, we would love to follow up with you at a later time about that, or one-on-one. Which brings me to our closing remarks here, is that I really appreciate everybody being here today. If you'd like to get in touch with any of the presenters, you can email me, and I'll make sure that I get it connected with everybody. My email is ghadley@dreamscapemail.com. I'm sure Dave is putting a contact email in the chat over there, and we'll do the same. If guys, if y'all don't mind putting your emails in the chat feature over there, we'll stay on just for a couple of minutes more, just so you guys can grab that. But with that, I'd just like to say thank you guys for coming here and being a part of this, and really painting this picture of this full service operations continuum. And we really look forward to continuing this conversation at future events in person. We'd love to see you out there. If you have any questions, please email and reach out to the presenters here. I know each of these providers are more than willing to talk about their area of expertise in a very open, collaborative way. So please definitely reach out. The resources are there. All right. With that, guys, thank you all so much. Appreciate everybody being here. We look forward to doing it again, and I hope you guys have a great rest of your week. Thank you all very much.
Thanks, everybody.
Thanks, everybody.
Thanks, everybody.
Everyone.
Thank you.
Bye, guys.